The Human Optimization Podcast is proudly brought to you by Vicon Supplements, where quality meets sustainability. Vicon's all-natural supplements are handcrafted and sustainably produced in Canada, bringing you products that nourish both your well-being and our planet. Visit viconsupplements.com today and be a part of a greener, healthier future.
Are you ready to embark on a journey to the best version of you? Join me, Lisa Pitel-Killah, as I dive deep into the world of hair tissue mineral analysis and functional medicine with fellow experts, and guide you on the path of unlocking your full potential. As a multi-time kettlebell sport world champion, I'm on a mission to reach high-performance professionals from around the world to help you minimize tiring symptoms, maximize health, and gain unstoppable energy. This is the Human Optimization Podcast. Welcome, everybody, to a brand new episode of the Human Optimization Podcast. I'm your host, Lisa Pitel-Killah, and I'm super excited about today's topic. I know I say that all the time, but today we're going to be talking about ADHD, autism, OCD, and so much more with Dr. Robert Melillo, a world-renowned expert in brain health, specializing in childhood and adult neurological disorders, a clinician, professor, brain researcher, and best-selling author of Disconnected Kids. He focuses on what I've already mentioned: ADHD, autism, OCD, tics, anxiety, and other developmental issues. Dr. Melillo is dedicated to bridging brain function, behavior, and physical health. His innovative multi-modal approach, the Melillo Method, has transformed thousands of lives. We are going to explore all of this groundbreaking work today, but I always love to start off the show with our guests telling us, how did you get here? Give us the background.
Yeah, well, thank you. First of all, it was I love even the title of your brain optimization, or is just optimization is just such a great way to look at it. And I too love origin stories. So for me, it really started as a clinician, really focusing on neurology and rehabilitation was my interest, my passion, trying to combine those two together, doing brain research or working with patients. But then as a parent, I was approached by some parents who had issues in their children. And then my own child was diagnosed with ADHD or something that they didn't really know, but he was very, very, bright and articulate and artistic, but he couldn't sit still. And so for me, right from the beginning, it was both professional and personal. And, it really started with a question, which was, what is actually happening in the brain? What is ADHD? What is autism? Where do tics come from? Because for me, to be able to try to use what I knew about, rehabilitation and brain and nutrition and diet and all of those things, I needed to know, okay, well, what am I trying to do? What is the problem? And I went around and talked to a lot of professionals who I thought or I hoped would know, and none of them really had any idea. But they were very certain that you couldn't do anything to help it, right? Which always I thought, well, you just told me you don't know what it is, but you're absolutely sure we can't do anything to change it. So I dove into the research myself. I spent a good 10 years really researching it, developing a program, eventually published a textbook called Neurobehavioral Disorders of Childhood and Evolutionary Perspective. And then from there, it's been an evolution of, okay, now I know what it is and how it gets that way. How can I change it in better and better ways in more and more severe conditions throughout the lifetime?
Yeah. Amazing. Wow. And I mean, having that so close to you, obviously to your heart, is a passion for why you go down those rabbit holes and why you did, right? So that's amazing. And so let's talk about understanding childhood neurological disorders. I feel like, even what you said there, where it's like no one has an answer, right? And I feel like a lot of people are left with no solution, or not even a solution, but not even a strategy of next steps. So give us some background on that, just some of the things that you've come across, and again, maybe even some of those beginning steps for digging into helping their children.
Yeah, right now in my career, I'm so passionate about what I do, and I'm at the really, I mean, I've seen more patients now than I've ever seen. I'm doing more research than I've ever done. We just came out with my 3rd edition of my book, Disconnected Kids. And I see people from all over the world every day. And literally the first question I ask them is, has anybody tried to explain to you what's happening in your child's brain or your brain? And the answer is always the same. And it's never changed really in the last 10 years. And the answer is no. No one's even tried to explain that. And it's amazing because just imagine being the parent and getting a diagnosis of autism for your child. There's probably nothing more scary or maybe devastating that you could hear. Not that it should be that way, but it is when a parent doesn't know anything and nobody tells them. And that's true for everybody. I mean, they don't even try to explain to you what the problem actually is.
Right.
And not knowing is worse. And, like I just had a doctor that, he's one of the top surgeons in New York City. He's, a top specialist at Cornell Weill, and his son, was diagnosed with autism and is non-speaking. And I said to him, if you are going to do surgery on someone, would you tell them what the problem is? Would you describe it? He goes, oh yeah, I go through everything. I have diagrams, I have models, I have pictures. I always explain to them what the problem is and what we're going to do about it. I said, great. Did anybody do that for your son? And he looked at me, he said, no. I said, didn't you think that was unusual being a doctor yourself? And he said, yeah, but I guess you're so taken up and in shock by the diagnosis that you don't know what to do. You don't know what to ask. So this is true for even people that are highly trained professionals. And for me, that's what I've been searching this for 35 years, and I've been researching it and writing about it and using it. And I think I understand it as well as anybody in the world right now. And not only, just what's happening in the brain, but how that impacts everything, meaning what's the universal theory? And autism for me has always been kind of like the biggest dog, meaning that, that is the most challenging. And that is why I wanted to understand it, because if you understand that, everything else is a lesser version of that. And if you can help that, then you can help anything.
Yeah, absolutely. And give us a little background just with regards to, there's different, for those who may not be super familiar, there's different levels of autism, right? You mentioned nonverbal. Give us some of those levels and some of the more difficult challenges as those levels increase, kind of what those look like.
Yes. You have a wide range. You go from, we don't even like to use the term higher functioning or lower functioning, but it's a better way. Let's say speaking versus non-speaking, right? You have people that used to be considered in the Asperger's range that maybe, highly verbal, highly intellectual, very articulate, but really struggle in the social realm. And they usually have, tics and repetitive behaviors and OCD. And they may have a lot of different autoimmune issues and immunological issues and sensory issues. And then you go to, let's say, someone that's on the non-speaking end of it that also has those issues. But people on the higher functioning may be hypersensitive to different types of sensory input, where people on the lower end of it, the non-speaking, are really diminished. Like they don't feel, or they may hardly feel any pain or temperature, or really not have a sense of appetite or feeling full. And that's really important, because one of the mysteries for me is, why don't they speak? Like, what is the actual problem? And no researcher has ever really addressed that. And I think I understand that now, and I understand what the actual problem is. And it revolves around that that inability to feel their body, what we call interoception and proprioceptive deficits, that are right hemisphere issues. And that to me is the primary problem.
Wow. And what are some of with restoring speech, let's say, if we're talking about that, what potentially, and I know this is a wide range, what potentially could the success rate be for a nonverbal child to be able to form words from that perspective? Is there a high percentage, or it really depends?
Yeah, we're compiling our data, but what I will say is that, from what we've been able to tell right now, I'd say about 80% at least, being conservative, we're able to get children that are non-speaking to speak to some level.
Wow.
And we also, with the use of things like RPM, which is, or spell to speak, we can get them to communicate using letter boards. And so they have some form of communication, which really gives us a window into what's happening, and really some unbelievable, fascinating stories in there. Because, one of the things that is very impactful is when you can use somebody who really doesn't have a voice and they find a voice, and then they can tell you why they don't have a voice.
Yeah.
And how much they want to have a voice. And then you can change that. I don't think there's anything, more important that I can do with my life. And, stories around that are just fascinating if you want to get into any of that. But, really understanding and it really comes down to, again, understanding what is actually preventing that from happening.
Yeah, absolutely. I would love for you to share one, I know you probably have hundreds and thousands of stories, but if you have one that just kind of stands out, you're like, this one, that was the day I remember. I would love to hear. I'm sure everybody would love to hear that.
Sure. There's many days, but recently, because again, each year I'm trying to get better and better and know more and more in what we do and kind of stack it on top of it. And the last couple of years for me has been just so amazing and mind blowing in what we've got. And, just to give a little understanding, my research, we have shown that the main problem is something called a functional disconnection, where there's a disconnection between networks in the brain. There's no damage, there's no injury, there's no genetic mutation, there's no metabolic pathology that is the primary underlying cause. The underlying cause is a developmental, maturational delay and imbalance that causes different areas of the brain, some areas to be overactive. Like in autism, it's the left hemisphere, and areas that produce tickling or stimming or OCD or anger outbursts or inflammation or overactivation of the sympathetic nervous system, along with underdevelopment in networks on the other side of the brain, like the right side of the brain in autism, which is where they have the social deficits, the nonverbal communication issue, the problem with not feeling their body, and all of those. And so really the primary problem with speech is not a primary language problem. What we've been able to find with from their own words and what we've seen is that, all the words are there. So imagine this, you have these kids, and everybody on the autism spectrum, whether they show savant level skills or not, they all have genius level, savant level skills in the left side of their brain. And they're severely delayed in the right. And what happens is that, many of these kids, they can read before the age of 2. I had one kid from the UK that could read at 8 months old, right?
Wow.
No one should be able to read really before 4 or 5. And so what happens in autism is there's a developmental delay, mainly because of retained primitive reflexes that delay the development of the brain, but in particular the right side, which is developing in the first 3 years. The left side comes online too early because they're incredibly gifted and it's so powerful, and that suppresses that right brain development even more. All the words are there, but they can't control their body, they can't feel their body, and because that they literally can't feel their tongue in their mouth, and they can't speak. So we have this one boy, Wesley, that had just been giving us unbelievable stories.
That's amazing. Wow. I'm stuck on I guess I never, when you think about speaking, we take for granted that that's what happens, right? We feel everything in our mouth, our tongue, that's how we move, that's how we talk. To think that you wouldn't have that, I can't even imagine what that would literally feel like.
Yeah.
Right?
Imagine having a genius level intellect with all the words, but you can't show it. And in fact, you do the opposite. You stim and you get anxious and you bite people and you don't want to do any of that, which is what they tell us, right?
Yeah.
And this kid, Wesley, he is a 12-year-old boy from Indiana, and the family is amazing. And he never spoke a word, and they didn't think he knew anything. Came to our center in New York and did really well. And we started doing the RPM, and the parents went back and started doing it. And he was telling us all this stuff and confirming it, that he didn't feel his body and he didn't feel his tongue. But he also said something that was really fascinating, because imagine if you've never spoken and you've never heard your own voice. Would you talk to yourself in your own head like we all do?
Yes.
Right? And he actually said, I do talk to myself, but I don't know what my own voice sounds like. So I use somebody else's voice. And then later on that day, he typed, I heard a noise in my head and I think it might have been my own voice. And then the next day, he typed for his mother, I just heard my own voice in my own head. This is so cool. You have to tell Dr. Melillo, right? And
No.
I mean, that type of information is just mind-blowing because you don't think about that. And it's so unbelievable. And you know it's coming from them because none of us ever even thought like that, right?
Well, and that's what, when you said that, it just, for me, it even took me a minute to digest it, thinking, wow, I can't even imagine what that would feel like, right?
No.
Because it's just, we don't know. And so when we're talking about, so with all your research and everything you've been doing, I feel like, I've been in the health space for over 15 years, which to your background is nothing, right? And I've always been a very health conscious person and what have you. But what I've noticed as well as I get further and further into functional medicine and different things is that there are more and more and more children with autism. I think when I was at, I always attend pediatric special needs conference. That's what I'm going to next week. And I think the last time I was there last year, they had mentioned that kind of the average, and I'm assuming you can confirm this because I'm trying to go by memory. It was about 1 in maybe 35,000 that would have autism. Now it's 1 in 43.
Yeah.
And then my question is, why? Is it our environment? Is it toxins? Why is that number growing so rapidly? And what's it going to be next year?
Yeah.
When is it going to be all, you know what I mean? Like, when is it going to hit one, like, just, it's a lot.
Well, like you said, and it's not just autism, it's all of it. But autism itself did go from 1 in 10,000, 30 years ago to now 1 in 36 children, 1 in 24 boys. Yep. There was an MIT researcher about a year or two ago that came out with a statement that she said, looking at her statistics, that 50% of all children being born in the year 2025 will be autistic. So why is that happening? My third book is all about this, by the way. It's called Autism, the Scientific Truth.
Yep.
And, it is really a combination of genetic traits, not genetic mutations. There is no genetic mutation in the majority of non-syndromic autism, which is 90%, 95% of autism. And that's a big misconception. People hear it's genetic and they think it must be a genetic mutation. It's not.
Right.
It's built on a trait, but that trait is really an intellect trait. Simon Baron-Cohen out of Cambridge has written papers showing that in the families of people with autism, there's a much greater number of physicists and engineers and mathematicians, doctors, people that are highly intelligent, that are more left brain dominant in their cognitive style. And that is where that power comes from.
Yep.
And so if you get people that, two people that marry that are both left brain dominant, which is happening more and more and more in society because we're moving more and more towards a left brain society, technology, digital technology, everything being more sedentary, being more virtual, less nature, less reality, less interpersonal. All of it is moving towards a left brain, and we're creating more left brain dominant kids. And that's a good thing, but it also leads to a vulnerability if that right brain isn't developed or if that left brain comes online too early. And that's also ADHD, that's OCD, that's tics, that's schizophrenia, that's depersonalization disorder, it's narcissism. It's so all of it, almost all of it is related to a right hemisphere delay or dysfunction. And so there are multi-environmental factors that affect people pre-conception. Some of it has to do with toxins in the environment and estrogen disruptors in our water supply, plastics, and those things that affect both mom and dads equally. The age that we're having children right now, dads on average are about 15 to 20 years older than they were, 30, 40 years ago.
Yeah.
And there's a lot of factors, but it's all being lifestyle driven. It's all being driven by, genetic traits and what we do on a daily basis, increased inflammation, the same things that are driving obesity and diabetes and cardiovascular is the same exact factors that are leading to developmental issues in children at epidemic levels. And it's absolutely real. It is increasing. It's not that we're just recognizing it, and it's getting worse every year. And and this has been my mission, is to be able to raise awareness, but to also give people real solutions on how to change it.
Yeah, I love that. And let's talk about, if there was one thing, just from a very basic perspective, that you could share to someone struggling, right, with a child, what would that be? A simple thing that could change something.
Yeah, right now, look to see if there are retained primitive reflexes, and learn how to stimulate those reflexes to inhibit them or integrate them. That's one of the single most powerful things you can do. But that also, if they're there, it also means that there's an imbalance in their brain as well.
Yep.
And learn how to address that at just a basic level. If you can do those two things, everything else is secondary to that. And if you do that, and one of the clues to that is if any of their milestones was not really just the way, you said optimization, human optimization. I love that, because any parent wants their child's brain to be built in the most optimized way, right?
Yeah.
In the most efficient, in the best way. They don't want it to be built just in the most basic or simple way. They want them to become their optimal version of themselves. And it's what I call a brain developmental blueprint. It's the way our brains have always been able to and supposed to be developed from the beginning of time, going back to evolution for eons and multiple species, right?
Yep.
And now we're saying, and the CDC is telling us, that doesn't matter anymore. You don't even have to crawl as a milestone. That's completely wrong. It just shows the insanity of the way that we're looking at things from a healthcare perspective. We're normalizing pathology more and more, and that's completely wrong. Know the milestones, and if your child doesn't hit those milestones in the way that they're supposed to, and they should walk right around 12 months, and they should speak, and they should be pointing and looking in your eye.
Yeah.
If they're not doing that, if they have any immune issues, eczema, reflux, something is going off the rails with their brain. That's what's causing it. It doesn't start in the gut. It starts in the brain. And you can change that really quickly and really effectively and alter the whole trajectory of their life. And you can do that at any point. But the earlier you can recognize it, the better it's going to be for everybody.
Better, yeah, makes sense.
And don't rely on your pediatrician to tell you any of this, because
that's why we're here, right? That's why we're here doing this, right? Because that's probably not going to happen. Yeah, absolutely. I always say, first of all, meeting amazing individuals doing work like you're doing is one of the selfish reasons I do this. But the unselfish reason is, if one person can watch this episode or listen to it and have an aha moment and take something away from it, then we've both not wasted our time at all, which is amazing.
Absolutely.
I want to dive in a little bit just about, because another big one is anxiety, right? I feel like in the last few years, not only children are affected, adults are affected too. We see so many more people on anti-anxiety medications, things like that. I have many people that I know, their children as well. Give me a little background on that, like just with regards to what I would consider an epidemic as well. I mean, I've never had so many people, even around me in my own circle, that are suffering from.
You're absolutely right. And anxiety is also epidemic. And again, there's different forms of anxiety. Everything that I look at it in what area of the brain is producing that, what area of the brain would normally inhibit that, and what do we need to do to change that? So my daughter is an incredibly talented singer-songwriter, and she just put together a podcast down in Nashville that I'm helping her with, because she's struggled with anxiety her whole life. And, I always say to parents and to people that if you have an imbalance, it starts with a gift. You have an area of your brain, or your child has an area of the brain that's really incredibly powerful, so that people that are gifted also often struggle with issues, right? Like Ed Sheeran has shared that he's dyslexic. My daughter was, essentially on the border of dyslexia, but she had a savant level of writing songs. I mean, she couldn't write or spell, but she could write songs with words and music from the time she was 9 or 10 without knowing how to read or write music. She's been produced by Zach Brown, and I know Zach has struggled with reading issues as well, but is obviously an amazing singer-songwriter. So these imbalances. So one form of anxiety that we doing this podcast really so she could share to the creative community that the right brain has certain emotions, right? And one is sense of danger. Yeah. So fear, which is one form of anxiety, a feeling like something is about bad to happen. It's a foreboding. She had this from the time she was a small child. She couldn't sleep at night because she was afraid that my wife or I were going to die or someone was going to break into the house. And she never told anybody that, right? Because another emotion that leads to anxiety is shame and embarrassment and guilt. So the right brain is wired primarily to connect with other people. That's the number one survival strategy for humans. The right brain comes online first in the first 3 years, and it is right from the beginning. To survive, we have to be part of a group. People have to love us. People have to protect us, and we want people to love us so desperately. And one of the biggest fears that we have is rejection, because if you get rejected in the Stone Age, if you were kicked out by your social group, it was literally a death sentence. Yeah. So the right brain is wired to read social cues and facial expression, and there's something called the salience network. And it's been shown that dyslexic kids have more activity of that. They read facial expression, they overread it. They feel like they're always being judged by others, and they judge themselves harshly, and they have low self-esteem, even if they're incredibly talented and creative and artistic and brilliant in certain ways. And they want to be social desperately. They want people, but they're also fear rejection. And that fear of being rejected and that shame, embarrassment of guilt, and the right brain generates sadness. So if we look at depression, how do you define it neurologically, right? Mm-hmm. So the left brain generates happiness and joy. The right brain generates sadness. Too much sadness, decreased joy, combined with shame and guilt, that's the definition of major depressive disorder, right? Yes. And that is what we see that in certain personality traits, and an extreme version of that is bipolar. Yes. So, what do? You actually address it by dampening that right brain, building up the left brain, and that's the solution for it without taking away the person's gifts, but with just balancing it out. And so that's the way I look at things. And, anxiety, that type of anxiety, that social anxiety. And I don't know, a lot of people who are probably listening to this are like, holy crap, that's me. I get that. Mm-hmm. And, in the creative world, they understand they may be incredible artists. They may be great painters. They may be great musicians. Yep. They may be just incredibly social. They may be designers. They may be just really good at reading people, too much so. But they may struggle with reading a little bit, or they might be a slow reader, or they might have been terrible at math and really not good with details and procrastinate. These are personality traits, and it all comes down to understanding that right brain, left brain. That's the answer.
Yeah. Wow. Amazing. That and I do feel like that it's almost like, you sit back and people are, well, one of the things that I think you can relate to, as I do, is we don't want to just mask it with medications, right? It's about working on the root cause of the problem to be able to actually, as you said, balance things out to find that long-term solution. And so Disconnected Kids, share a little about that.
Yeah, that was a book that, when I originally wrote my textbook, as I talked about it, and then I started writing scientific papers. Mm-hmm. Then, I wanted to put this in the hands of people everywhere. I wanted to make it accessible because I knew I was getting results in my practice from the very beginning. And I saw this epidemic coming over 30 years ago. And I knew we were going to be here. And I knew that I wanted to make a difference. I wanted to make an impact. I started teaching other doctors and other therapists around the world my technique, but that wasn't fast enough. So I said, you know what, I need to literally put this in the book so parents can read it, or people can read it for themselves, and they can apply my method at home or to their own child. And so that's where Disconnected Kids came out. And that was, my first book. That was a in the, general public, and it was published by Penguin, and it was published in 2009. And right from the beginning, I think, what really resonated with me was how people connected with it. They read it, and I have a list in there that goes through, right brain, left brain symptoms.
Mm-hmm.
And if you do that checklist for a parent, parents would reach out to me and say, oh my God, like, how did you know my child? This makes so much sense to me. This is him. This is her. And, how did you know that? You never met them. And that would be the thing, I think, that people would come up to me and say, it just makes so much sense, because it's one of those things that when you read it, it's all of a sudden like, oh, of course, this is how it works.
Mm-hmm.
It's one of those obvious truths that that you don't think about it, but when you hear it, it's like, yes, okay, I've been looking for this. And so, it's really resonated with people. And now, it's on its third edition. It's been translated into 18 languages around the world. It's one of the best-selling books in this genre. It's been on, multiple Amazon bestseller lists. I think it's, even now, if you go on, it's probably in the top, 8,000 or so. But it's been, and that's because it's more relevant now than it's ever been. And it's more popular now than it's ever been, which says a lot for a book that's been around for 15 years, really.
Right. Absolutely. Well, and I'm curious because you said that you saw this coming 30 years ago. What was it that triggered that thought? Like, what was it that made you think that?
Yeah, great question. So when my son was labeled, and when I then somebody, my parent teacher said to me something about that with him, right off the bat, myself, I'd seen a lot of fads in medicine come and go.
Yep.
And so I had a lot of teachers that I treated, and I really respected them. And there was one woman that was a teacher for, many years in elementary school. And I said to her, this ADHD thing, is this real?
Mm-hmm.
Because I had also, driving to work around that time, I had heard in 1995 a statistic that said from 90 to 95, the use of Ritalin in the United States had increased 250%, and no one knew why, right? So that was the beginning of it. I was like, oh, something's going on here, right?
Yeah.
But my first instinct was, is this real? And so I said this to this woman. I said, is this a real deal thing, or is it just a new hype or fad? And she said, oh, you have no idea. Like, the look on her face was like, you have no idea how real it is. She said, 50% of my students in our school at lunchtime line up at the nurse's office to get their pill, because that's how they used to give it at that time.
Uh-huh.
And I said, 50%? I was like, I had no idea. She said, no, you have no idea. I have friends of mine retiring because they can't take it. She said, get a book called Endangered Minds by a woman named Jane Healy,
mm-hmm.
and read it. And I did. And she was a teacher for 30 years and a PhD and a principal.
Yep.
And she starts out the book by saying, I would go into the lunchroom and say to my colleagues, are children's brains changing? Because these are not the same kids we taught 10, 15 years ago, right? They can't pay attention. They can't sit still. They're bright, but they're all over the place.
Mm-hmm.
And I said, wow, okay. And then I read that book, and then I started looking into it, and I went and I said to this woman, I said, the teacher that told me that, I said, why do you think this is? And she said, I don't know how it works, but I think it has something to do with kids don't use their big muscles anymore. She said, I watched them on the playground. They don't run around and play like they used to. She goes, drive around in the neighborhood. They're not climbing trees. They're not riding bikes.
Yep.
They're inside watching TV or playing video games. And I was like, oh man, now she's relating it to motor development and movement. And now I know this really well. And I'm like, okay, I get this. And I said, you know what? This is only going to get worse. This is just the beginning, because we hadn't even seen iPhones or anything like that yet. And, I kind of had an inkling that more was coming, and it's even more than I ever dreamed. But, that's why I think what I'm doing is so relevant, because I wrote it from that perspective, from a future perspective.
Yeah, absolutely. Wow. It just, and it's so interesting too, because even just looking at those different, career paths, right? She's seeing this, other people aren't aware of it, like yourself, and just being like, oh my gosh, like this is this is now real. Right? You're understanding and putting the pieces together and realizing how real it really is.
Yeah, and people out there, again, you hear geneticists or you hear people that, get grants for doing genetic research or, people that are, maybe in, different professions, and they'll say, well, we're just recognizing it more. It's not really actually getting more. Let me tell you, go speak to a teacher that's been teaching for 20 or 30 years.
Yeah.
Go listen to the educators on the ground, because the average doctor isn't seeing a lot of this, right?
Right.
And so go and speak to them and ask them if there are more kids or if it's just your imagination, or because again, especially like kids that are non-speaking, that's probably the fastest growing area.
Yeah.
And you're going to try to tell me that 30 years ago, there were all these kids that weren't speaking and we didn't recognize it, that it's pretty hard to miss, right? I mean, you could argue that with ADHD, that maybe it was just considered a bad kid or whatever, right? But autism and non-speaking, you don't miss that. And that wasn't there. There was no way there was this amount of kids that had this issue, 20, 30 years ago, 10 years ago. It is increasing at epidemic levels, and people that say that it isn't really don't know what they're talking about, or they have their own agenda, because there is no such thing as a genetic epidemic.
Yeah.
So that means that if it's not genetic, if it's not a genetic mutation, then all of their research is a waste of time, and all their grants that they've gotten really don't amount to much, and they won't admit to that, of course.
Of course. Wow. That is, I feel like Pandora's box has opened. So I want to tell people how to disconnected kids. We know where to get that, so that's fine. But about your method, right? How do they learn more? How do they
Right.
work with you? We'll have all the links, of course, how to find you and everything in the description. But let's talk a little bit about the method and kind of, how they can find you if they want to work with you.
Yeah, so if they want to work with me, my website, drrobertmelillo.com, or Instagram. I have a really active following on Instagram at Dr. Robert Melillo. And I actively am in practice. I see patients every day. We have a really active practice on Long Island. We're opening another one in about 2 weeks in New York City, right across from Empire State Building, because the demand is so great. And I will be in both offices on a weekly basis, but I have an amazing staff of people.
Yep.
I've also trained doctors and therapists around the world, but we're also going to be helping others to open and reproduce what I do in my practice. Because that method is very specific on how you do it.
Yeah.
But it's we have a lot of ways that people can learn about what we do. We have a podcast that I'm doing called the Melillo Method Podcast, Everything Brain.
Yeah.
My wife and I did a web series called Disconnected Kids Reconnected Families. That's on Your Home TV, which is a streaming network that was started by Kathy Ireland. We have over 4 million views in 1 year. We've been the number one web series on that network. We have a lot of papers, and the last paper we published last year, we published 7 papers last year, but the last one was in the British Medical Journal of 3 of the cases, and literally we published step by step what we did, right? So literally it wasn't the full method because we needed to isolate certain things, but it's in the British Medical Journal is one of the top journals in the world. So I think that we tried to create as many different avenues for people to learn, to give them real information. And that's what the books are all about. And I have 7 books that we've published, and all of them are really designed to be manuals that people can use.
That's amazing. Well, and that's one of the best takeaways. When you have a book that you can put into practice, I mean, what's better than that?
Yeah.
Right? Yeah.
Yep. And I have a course that I've been teaching for about 25 years on the really high level fellowship level. And that is available online, and anybody can take that course. Even a non-health professional can take it and be certified. But there's a fellowship that's only for healthcare professionals, and they can get that through my website.
Amazing. Amazing. Well, like I said, we'll have all of the links in the description. And for those of you who tuned in today, thank you. We have a brand new episode on YouTube every 2 weeks, so make sure you follow my channel. Give this episode a thumbs up. And if you're listening on your favorite podcast host, we thank you for joining us, and we will see you next time. Thanks for joining us today on the Human Optimization Podcast. Episode technical production is by Grace Sylvester and guest booking by Stu Tate. Want to learn more? Visit lisapitel-killah.com for incredible free resources to supercharge your journey to becoming the best version of you. If you enjoyed this podcast, please like and subscribe to the Human Optimization Podcast and follow me on social media at Lisa Pitel-Killah.